Adolescence is an exciting time of life, one of rapid physical, mental, and developmental change. Health and well-being in this period has a lasting impact into adulthood. I work closely with our experts who focus on adolescent health, specifically in their research and clinical work. This time last year, Dr. Shelby Davies and I wrote about the data we had then and the opportunities we saw for supporting adolescents' access to healthcare at a time of rapid policy change and mounting uncertainty. We've since seen changes in federal policy and funding related to school-based mental health supports, removal of sexual orientation and gender identity data from federal data collections, and cuts to funding and new restrictions on participation in programs like SNAP and Medicaid. Our team at PolicyLab has been working to consider the blind spots, and by that I mean many policy changes don't necessarily target adolescents, but they're likely to impact their health, including through access to coverage and healthcare. We've homed in on 4 areas that are particularly relevant to adolescent health and to which PolicyLab researchers can really bring their unique perspectives. First, keeping adolescents covered, especially as they transition from pediatric to adult care. Second, ensuring access to behavioral health care. Next, promoting inclusive approaches in healthcare and other youth-serving systems. And finally, maintaining confidential sexual and reproductive health care for young people. We're turning to our research to consider how policy changes stand to impact these areas and to ask new questions, like what happens to young people with chronic conditions when Medicaid policies change, and what kind of support can help them navigate these transitions. In this chapter of our Blind Spot series, we'll be sharing our research and what we anticipate being some of the unseen consequences of policy change and policy uncertainty. We'll also highlight where we see opportunities to mitigate harm and what we know about setting up adolescents and young adults to thrive. So stay tuned as we share on our website and social media channels this spring.